Hi, I'm Bill Arnold. Thank you for listening to this podcast. There are many more podcasts available at myfaithradio.com. Your support makes this possible. Thank you. Hi, this is Bill. It is with sadness that I'm doing a tribute show today, reflecting on the loss of a fantastic guest. The departure from this life to the presence of the Lord happened rather suddenly and unexpectedly. So I want to have a show today to not only honor but pay tribute to the amazing contributions that he made and the friendships that he made here at Faith Radio. This is for Dr. Kerry Johnson. He was a NUCA specialist, and he helped me many, many times with some of the issues I had, and he was a great healer and a man who loved the Lord and loved taking care of people. And a warm welcome to the Bill Arnold Show. It was a couple of days ago I got in my car, and all of a sudden I had an indicator light on that I had a tire that was low. And I thought, wasn't it kind of nice that I have an indicator light that I've got a tire that's low? So I went and got some air for it, and the next day I woke up, and guess what? The indicator light was back on, and it was still losing air. And I thought, I know exactly what to do now, and I took it in, and sure enough, there was a nail in the tire, and I got it fixed, and all of a sudden now the tire's working the way it should and holding the pressure it needs to hold. Now, where am I going with this, Bill? All right. Wouldn't it be nice if we had a little light that went on that said, you know, your body is a little bit out of alignment? We don't have a light, but we certainly have indicators, and there are ways to discover what might be creating some issues. And I'm so glad that I have Dr. Kerry Johnson with me in the studio today. He is the founder of Johnson Spinal Care, and he is a NUCA doctor. The NUCA is the upper cervical area of the neck. It's this bone called the atlas. And I have to say, I've been to Kerry a number of times, and I was in so much pain. Well, I was in a horrible car accident years ago, and I've also just had a number of other occasions where I was in a lot of discomfort, and I was really out of alignment. So in other words, that little light was on in my body, and I was able to get it fixed thanks to Kerry and his amazing service. He's a godly man who loves the Lord and loves to help care for people, and he's with me today. Kerry, so nice to have you back.
Thank you.
Yeah.
It's so good to be back.
What was my analogy like with the tire? Because if we had that, we'd know when we needed help.
Well, and what's interesting, I'll play along with that analogy.
Okay.
Having an indicator light that tells you your tire's low is a safety. It's a safety device.
Yeah, it is.
Because, if you're running with your tire low and you don't know it, that could lead to really big problems, and put you at risk for accidents and all kinds of crazy stuff. So,
yeah.
Yeah.
You've dedicated your life to studying the upper bones. You're part of the National Upper Cervical Chiropractic Association now. So it's the bone called the atlas. Mm-hmm. Am I right?
Yep.
And it's what your head sits on.
Yes.
Now you might be out of adjustment or out of what would be the word? Help me here.
Alignment.
That's
out of balance.
Yeah, out of balance or alignment. You could have been out for decades.
That is a fact.
Yeah.
Yes. I see a lot of newborns. Moms will bring their child in to get checked, and I end up having to make a correction of probably about 1 out of 3.
Wow.
At the top of the neck.
Wow.
Following the birth process.
So discuss and let us know what happens with blood flow and the cervical spinal fluid and how that affects our balance, our sleep, our coordination, our energy, everything.
Yeah, so several years ago, NUCA did a study on migraine headaches. And MRI technology has allowed researchers to actually measure flow, blood flow, arterial flow, venous flow,
Mm-hmm.
and CSF flow. So arteries are the high-pressure vessels that push blood from our heart out to our body and oxygenates every tissue in our body. Our veins they're a low pressure, and they return blood back to the heart. And right in the middle of both of those is what's called cerebrospinal fluid. And the cerebrospinal fluid, it cushions and protects our spinal cord and our brain.
Mm-hmm.
But CSF also has another really important job, and it house cleans our brain. In fact, research a few years ago discovered that in the very deepest part of our sleep, our brain cells actually shrink and allow CSF, cerebrospinal fluid, to get into the innermost nooks and crannies of our brain and clean house.
Wow.
And, our brain uses glucose, blood sugar, a lot of it, and a lot of oxygen. Like 20% of every breath we take in is being used by the brain. And anytime you burn fuel, oxygen and sugar, glucose, just like the exhaust in your car, there's byproducts that come out of that. And CSF cleans all that out of the brain. And so what we're just now finding, in fact, after the migraine study, then we started looking at blood flow patterns in people that have had concussions. And what they were finding is that, so when you lay down at night, the jugular vein is the big vein that comes out of your head. So it drains your brain back to the heart. And the jugular vein is supposed to have twice as much flow at night when you're laying down than it is when you're upright. So when you're standing upright, blood is returned from your brain to your heart through other vessels, other secondary vessels. If it came down the jugular vein when we're upright, it would be too fast and we pass out. And so, I mean, the body is just so wonderfully made.
It is,
right? And it's so complex.
I'm so fascinated.
It is very fascinating. And so the arterial pressure, then arteries, is the highest pressure, and your veins are the lowest pressure.
Okay.
And CSF is made inside the brain, and it flows around the brain, down the spinal cord, and kind of back up. It moves with every cardiac rhythm, and then it actually ultimately ends up draining into the jugular vein inside the brain, and then down back to the heart, and then it's cleaned out by the liver and the kidneys. And what they found is that these athletes that had concussions, you lay them down, and they took this MRI measurement, and they found that they're not draining through their jugular vein like they're supposed to. The blood was going through secondary veins, which is only supposed to happen when you're upright. So what happens, it causes a back pressure. The CSF flow is a little bit higher pressure than the veins, than the jugular vein. And so that's what allows the CSF to drain out of your head into the jugular vein. But if the jugular vein is blocked, it increases the pressure, and then the CSF can't drain into it. And you get this whole back pressure in your brain.
Is that called the migraine?
It could be a migraine. It could be brain fog. Could be balance issues, dizziness. All different sorts of headaches, visual disturbances, depression, anxiety. And so it's fascinating. You know, as a chiropractor, we've focused on the function of the nervous system pretty much since our inception, and thinking that, you know, headaches were a nerve problem. You know, the brainstem that's getting stressed, because the brainstem comes right into that upper neck as well. But research is actually showing us that it's a fluid dynamic problem. When you shift that top vertebrae out of its normal position, it blocks that jugular vein. And so I had about 24 referrals over the last 2 years from a neurologist at the U of M with patients diagnosed with internal jugular vein compression. And the first time I heard it, I'm like, what's that? And what could be causing that? And I'm the kind of person, Bill, that I have to figure out why. I remember when I was a kid, I got a new bicycle, and I was fascinated by when you push your foot backwards on the pedal, the bike would stop. Mm-hmm. So first thing I did with my brand new bike is take the whole rear hub apart to try to figure out. And that's just kind of who I am.
Yeah.
And so I actually enrolled in a 3-year program, focusing. It's a diplomate program, a degree program in our profession, to learn more about what I'm talking about and what could possibly be causing internal jugular vein compression. So it's interesting because on this coming Monday, I have a meeting with this doctor.
Oh, fantastic.
And she wants to know what NUCA is, and so we're going to take a whole live patient through and show her the process.
Yeah. Dr. Kerry Johnson is my guest. We're talking about the upper cervical bones in your neck. Now, Kerry, describe what the atlas is and how not only amazing it is that God has given us these bones that our head can swivel on, but when we're out of alignment, our head's not going to swivel very, very well, and it also might cause pain in our hips and our legs, everywhere, shoulders. I mean, I've been to you for a number of things that were out of whack, and you fixed them pretty instantly.
Yeah, well, again, we give God glory for everything that happens in our clinic.
I know you do.
And the fact that He's given us a gift. It's kind of a side note. When a new doctor joins our team, we actually lay hands on them.
Nice.
And bless them to have a healing anointing. Yeah. And so we believe God participates in everything that we do, and at the end of the day, we give Him glory for it. Mm-hmm. So, our head is like a bowling ball. Right? It's 10 to 14 pounds, okay? I have a really big head, and I tell everybody because I have so many brains, but my wife says this because I have a thick skull. But anyways, but I'm bummed. So we have this big noggin that sits on the C1 vertebra or the atlas vertebra on 2 joints about the size of our knuckle. Mm-hmm. There's no disc at the very top like there is in the other vertebrae. Yeah. So it's a bipedal support. Our head sits on 2 little joints. Mm-hmm. And the motion between our head and the top bone is a flexion extension, tipping our head forward and tipping it back. Mm-hmm. Then the joint between C1 and C2 also doesn't have a disc, but C2 has a little post that sticks up that the atlas vertebra pivots around. So the primary motion between C1 and C2 is rotation of our head. Mm-hmm. As a matter of fact, it's about 45 degrees of rotation each way occurs between C1 and C2. So it's extremely mobile. And when half of your head movements occur just between 2 vertebrae, it's amazing. Mm-hmm. But what it also means is the top 2 joints are more susceptible to injury and buckling out of place more than any other segment in the spine. So it's a highly movable area. It's the most complex joint in the spine, and each person's misalignment is actually about as unique as their thumbprint. Wow. No 2 are the same. Really? Mm-hmm. Because I was in a car accident years ago, and I think this is how I ended up at your office. I had kind of a stiff neck for about 6 or 8 months. I can't remember, but someone would say, "Hey, Bill," and I'd have to turn my whole torso to look that direction because my head wouldn't turn independently. Right. And there was pain in that tells you right then and there that there's a misalignment probably between C1 and C2 because that's where you're supposed to be turning. But I kept thinking I'll just walk it out, and one day I'll wake up and it'll be fine. Right. And it wasn't fine after 6-8 months, and so I came and I got adjusted, and you said after looking and examining that it was significantly out of alignment, and I can't believe that I walked out of there feeling like I was a new man. Mm. It was remarkable. Well, we do hear that quite a bit. Yeah. So when it comes to alignment, would you say that most of us are walking around with alignment issues? Conservatively, I believe 9 out of 10 people have buckled the top of their spine by the time they're 18 years old. And if you think about a normal childhood, right?
Yeah.
You're 2 years old and you do the header off the top bunk
Or trampoline.
Trampolines. Yeah, they're really good for business.
I bet.
Dentists and trampolines. No.
Yeah.
But
sports and all the bumps and bruises you take.
Falling out of trees, hay lofts, right? The jungle gyms. I mean, there's all kinds of opportunities. And interesting, children, their head is proportionally larger than their body because our whole development starts with our brain. So the head in a child is actually, it's more of a burden for their little necks than an adult is.
I didn't know that. That's so interesting. All right, Dr. Kerry Johnson is my guest, and if you have a question about what we're talking about, you can text it over 877-933-2484, and we'll take a short break, and we'll be right back. We carry each other's burdens. Please know you can bring us your prayer concerns, and we will pray. Share your prayer requests with the Faith Radio team by texting or calling 877-933-2484, or share your prayer requests with the Faith Radio staff and listeners at myfaithradio.com. Welcome to the show. Dr. Kerry Johnson is my guest today. He is the founder of JohnsonSpinalCare.com, and he specializes in the upper part of your neck where your brain, your head sits on, the bow tie-like bones called the atlas. And it is a delicate, God made us this in the most marvelous way, but it is a delicate positioning because the way our heads move, and if we get out of alignment, our heads stop moving like they should. We see that all the time, Kerry, with people that don't move their head as well, and then all the things that are associated with a head that doesn't move well, and it can be headaches, problems with sleeping, dizziness, blurred vision, all kinds of stuff.
Mm-hmm. Yes. Yeah, so when there's an injury to the top of the neck, whether it's a whiplash or a direct impact, the head shifts on the top vertebra, okay? And then the top vertebra will shift on the second vertebra. So you have misalignments usually you'll have misalignments at both of those upper joints when you have a trauma. And so when that head and that top bone shift on the second vertebrae, or the head shifts on the first one, and the first one shifts on the second one, it puts the head off center, okay, so that it's unlevel. That's the immediate impact of that injury. Well, our inner ear, which balances our head, the vestibular apparatus, and our eyes, they don't like the head to walk around unlevel. So they will always try to get the head back level. So when you misalign your head on top of your neck, then what has to happen for your head to be level is your lower body adapts, and it shifts a little bit off center to get your head back straight. And so you walk around out of balance from top to bottom. We lay people on their back and we measure in leg length, and we'll see that one leg appears shorter than the other one every time somebody has an upper neck problem.
Yeah, so your body is trying to compensate so you can see straight ahead and not be dizzy, but in the process you might be torquing your hips or walking in a strange way, which is causing all kinds of problems.
It's a stress for every weight-bearing joint in our body. And, so that, I was 22 years old, halfway through chiropractic college, and my lower back was so bad I couldn't sit in a desk. And they were telling me I was going to have fusion surgery. And that was a lower back problem. And I tried all of the different chiropractic procedures because there's a lot of them. And classmates said, go see this guy down by the airport. He does a little different thing. And he took these 3 different x-rays of my neck, had me come back the next day, laid me down on a little table about a foot off the ground, and he I thought he was getting ready to do something, and then he said, "Yeah, I think we got it."
Yeah.
He got up and he took a follow-up image, apparently so we could check his work, and I didn't think he did a thing because I couldn't feel the correction. And I went back home rather indignant. It was an hour drive each way, and tank of gas and whatever. The next morning, I woke up without any lower back pain, and I've never come back since.
Wow.
Decades ago.
Wow. So I saw you, I don't know how long ago it was, but I I wasn't walking great. And you said, boy, your pelvis is a little out of alignment. And then you made the adjustment in my neck, and then my pelvis didn't hurt.
Mm-hmm.
You always think, well, aren't you going to do some kind of popping or twisting or cracking in other parts of my body? And the answer is no.
Mm-hmm.
So maybe you would just do a description of what the NUCA treatment looks like and feels like. Because the first time I had it done, Kerry, I thought, are you doing anything?
Right.
Is anything really happening?
So the hallmark of the NUCA correction is accuracy. And so we actually have cone beam imaging now in our clinic, which is full 3D imaging. And we analyze the misalignment of the top of the neck in all different planes, the frontal plane, transverse, sagittal plane. I know those are big words, but, it's the side-to-side misalignment, the rotation misalignment, and even front to back. And we analyze it using tools. The doctors that developed this work were genius. Mm-hmm. This was decades ago. Mm-hmm. And so we do a whole physics analysis, basically, on the upper neck, and that gives us the exact pathway that each person has misaligned into. And then we calculate, through math and physics, an exact correction angle that will oppose the pathway of the misalignment. And it's very fussy. But what we find is that the more accurate we can be with the corrective force, the less force you have to introduce. Mm-hmm. So we lay patients right on their side. They're supported very firmly, their head is, so it doesn't move. And we put in just a little impulse right under their ear, right where the C1 vertebra is. And we actually use C1 as a lever to move C2 and the rest of the spine underneath the center of the head again. Mm-hmm. We get people's head back on straight. And the moment that happens, then the whole body comes back into balance right to left, posturally.
Mm-hmm. Yeah. There was a graphic on your website at johnsonspinalcare.com, and I think it was a little video, and it showed someone with a big breaker switch. Mm-hmm. And if you're out of alignment, the breaker switch has been shut off.
Right.
And I always think of the big breaker switch in my house, which shuts everything down.
Yeah.
And if that breaker switch is down, nothing's going to fire. So when you get aligned, it's almost like the breaker switch is put back on and things can start to flow again.
Well, everything is really packed in tight right at the top of the spine. Mm-hmm. And so, I mean, even you have 22 different muscles, 22 or 23 different muscles that connect to the very top vertebra. And and then there's the brainstem coming down the spinal cord that doesn't become spinal cord till it passes the first bone, and it's very wide there. There's cranial nerves that come right in front of the vertebrae. Again, the jugular vein lays right in front of the top vertebrae. The vagus nerve, and I know that's becoming a catchword today, vagal nerve issues.
What does that mean, Kerry?
The vagus nerve is your main digestive, it's your main parasympathetic nerve to your whole body. So
okay.
Our autonomic nervous system, or automatic nervous system, has two parts to it, parasympathetic and sympathetic. Okay, it's like fight or flight versus rest and digest. Okay. And it's actually, as soon as we shift out of a line and we have this posture stress, the very top joints they're hot wired into the hypothalamus, which is the part of our brain that drives our sympathetic. So when somebody actually moves out of a line, they move right over into just this low level sympathetic dominance, a stress situation, right? And of course, research has shown that long-term stress isn't good for us. And so then you have this inherent stress already because of the problem, and then you add other stresses of life to it, and pretty soon we have all kinds of problems. Mm-hmm. So,
Kerry, ever since I met you, I have this general awareness when I will be at the grocery store or I'll be out somewhere at the mall or something, and I'll see someone and I'll think, based on how they're walking, they are horribly out of alignment mm-hmm. because their body is trying to compensate for something that is not working correctly.
Right. Oh, yeah. I see it a lot. I see it, too, in sports. I see it a lot. Like, I'll be watching a hockey game, and I'll see somebody that's got their right and left stride is different,
Oh, sure.
Or I watch somebody run down the sidewalk as I'm driving by, and you'll see one leg that flares way out every time they take a step. So My lens is that through imbalanced posture. Yeah.
Now, you recently were able to take care of a number of professional athletes on a football team. We won't name the team, but you have a lot of customers and patients who are playing pro sports because they get beat up pretty regularly.
Yeah, that's a fact.
Yeah. All right, here's a question that's come in. I've had dizzy, balance, and headachy symptoms for a year now. I've been told that I have vestibular hypofunction or left vestibular nerve. Next up is Dizzy and Balance Clinic. Are you familiar with cases like this?
Yeah, so the vestibular apparatus, which balances our head, oftentimes when it's dysfunctional, it's a room spinning type of dizziness. Okay, and so if the problem is truly in the inner ear, then it may not be related to a misalignment of the top of the neck.
Okay.
Top of the neck types of dizziness is oftentimes more of the room is moving or you're not right with the room. Almost like sea legs if you've ever been on a cruise. But at the same time, I've also seen, because there's blood vessels that lay right over the top of our cranial nerve 8, which is the cranial nerve that feeds the inner ear. And so sometimes even pressure on that nerve inside the brain, because of increased venous pressure from what I was talking about earlier, can be a trigger for even the inner ear type of dizziness as well. So
a lot of people have that. Mm-hmm. I've had the dizzy stuff before, and that is not pleasant at all. Yeah,
the one that won't respond is if it's that, where the like middle age and you get the crystals that shift. Then you need to do a different. There's a therapy procedure for that.
Yes, I've done that.
Epley's maneuver.
The Epley maneuver. Yeah. All right. Here's another question, Kerry. X-rays revealed my neck was curved 6 degrees the wrong way. Checking my blind spots while driving, I have had to turn my whole torso. I've had trouble swallowing in the past. Pretty sure I need some adjustments. What do you say?
It's probably a safe bet.
Okay.
Yeah, our neck is supposed to curve towards the front. We have 3 primary curves. When we look at somebody from the side, and you look at them, their neck should curve forward, their upper back should curve backward, and their lumbar spine, lower back should curve forward again. Mm-hmm. From full flexion, if we tip our head all the way down to our chest, and full extension, we tip our head all the way back, the spinal canal will lengthen as much as 3 centimeters. Obviously shorter when you tip back, but longer when you tip forward. So our spinal cord is supposed to lay on the concave side of that curve, okay, right? Well, if you reverse the curve, you get a cervical kyphosis. It lengthens the canal, and it stretches your whole spinal cord, and it can actually take your brainstem and pull it down into the foramen magnum a little bit and cause some of these issues that we were talking about before, where the brainstem actually corks into the foramen magnum, which is the hole in the bottom of your head that it passes through. Mm-hmm. Just like a wine cord. So you shift the atlas vertebra, you have a reverse curve, and now you've got that CSF flow interruption that I was talking about, or back pressure, where it can't get out.
Yeah. I don't know if
So it's a pretty common one. So cervical kyphosis is not healthy for your CSF flow or your nervous system.
Mm-hmm. I don't know if I understood half of what you just said. But
sorry.
No, it was very interesting and a little bit technical, but I appreciate your wisdom on this, because it is the way God designed our bodies is so unbelievably fascinating. And when we have a simple misalignment in that bones in our neck, how it affects everything.
It is.
And I know there's lots and lots of people that would be listening right now that are probably having issues with some dizziness or brain fog or sleeplessness or headaches or who knows what else. If you have a question or comment for Dr. Kerry Johnson, feel free to text it over, 877-933-2484. You can learn more about him and his practice at johnsonspinalcare.com. We'll be right back. Hi, this is Bill. I thought this interview was so good, I wanted you to hear it again. So enjoy. Welcome back to the show. So glad to have Dr. Kerry Johnson here with me in studio. And Kerry is the founder of JohnsonSpinalCare.com and also is a NUCA doctor, which is the NUCA stands for the National Upper Cervical Chiropractic Association, that little bow tie bone that your noggin sits on. And when that gets out of alignment, it causes all kinds of problems in your body. And I know just for a fact that I have had some amazing results from this procedure, and it has helped me in ways that I feel like, Kerry, you kind of dug me out of a hole a couple times.
Thank you.
Yeah. So a question came in about Chiari 1. I do not even know what that is. What does that mean? This listener is being told that they're concerned about possible jugular vein compression, and they want to do some crazy test to test the pressure in the head. What is Chiari 1?
Yeah, so a Chiari malformation is where actually the part of your brain that's in the very bottom of your skull is called the cerebellum. And that part of your brain actually, it herniates, so to speak, down into your spinal canal. And that is another cause of fluid flow problems, CSF back pressure. Because the cerebrospinal fluid can't exit the brain, it's produced in the brain, and so if the canal, like CSF, surrounds the brainstem and the brain and the spinal cord, and now all of a sudden, if you stuff part of your brain into the hole that your brainstem goes through and CSF goes through, there's not enough room for the CSF to go through, and then it builds up pressure in your head. You've heard of hydrocephalus, is like, where your head gets big in children. That's a problem with cerebrospinal fluid not clearing out of your head, or you're producing too much of it. So it causes a ton of pressure on the brain, and it also inhibits blood flow in and out of your head, as we were talking earlier. And now I don't know that the cerebellum can actually impact the jugular vein itself, but I'm just learning about this, and that's interesting. In this meeting, I have come up with a specialist. Mm-hmm. She's seeing that most of the jugular vein compression that she's measuring is right at C1 and C2, and right at the top of the neck. And so we have had many Chiari patients in our clinic that have responded. We've had others that haven't. What I tell everybody is, like, if you're having unresolved problems that just aren't going away and everything you're doing isn't helping, you should consider getting checked, having a NUCA doctor check you.
Sure.
It's one of the most conservative things you can do for somebody, really. And you've experienced it. You don't even feel the correction. It's safe.
Well, I don't even think anything's happening. That's the crazy part.
Right, exactly.
Yeah, there's no trauma to my body. It's almost like you're putting your hands on my neck and pushing around a little bit, and then you go, there, you're done. You're back in alignment. And
when you're pursuing healthcare, you always want to start with the most conservative.
Yeah.
And then work your way more towards more aggressive procedures.
Yeah.
Right. If the conservative isn't working.
Yeah.
And people just have this fear of chiropractic, and it's one of the most conservative treatments that you can offer.
Yeah. You probably don't remember all my aches and pains, but I came in once with my right arm in so much pain that I had a hard time lifting it up. And then you took my arm and cranked it up a little bit, and I think I yelped a little bit because it hurt so bad. And then you adjusted me, and then you picked it up again and moved it all around pain-free. I started laughing.
Yeah.
Come on, Kerry.
Yeah.
That doesn't work that fast. But in fact, it did. All right, here's a question. What can I do with numbness in my fingers from a whiplash neck injury in 1995?
Well, I will say that, number one, the more chronic a problem is, the longer the recovery.
Okay.
Or even the less likely of a full recovery. So it all depends upon whether the nerve has been damaged.
Okay.
Because once a nerve is damaged, especially in the neck, you won't get a 100% recovery.
Mm-hmm.
But if there's continued pressure on the nerve because of a misalignment, and we take the stress off of that nerve by putting the head properly on top of your spine, then there is some hope. I would probably want to look at an MRI report
Sure.
before I would even take a patient, that's got that kind of a problem. The MRI reports, I've been reading them long enough that I can usually tell based upon what the radiologist is saying if there's hope for them or not.
Mm-hmm. Dr. Kerry Johnson is my guest. And Kerry, when I think of the NUCA chiropractic spinal care, how is that different from other care? I know we've been talking about the adjustments, but the most chiropractic practitioners don't do what you do. And why not?
So most chiropractors, the more common procedures really deal with mobilizing a joint that's locked. And when you make a manual adjustment where you get the little clicking or popping on a joint that's fixated or locked, it helps that joint function, okay? And people feel better. And that's why chiropractic has been successful and helped, millions of people and gotten them out of pain. And but when it comes to the very top part of the spine, it's such a complex joint, and the NUCA procedure wasn't introduced into the colleges for decades because the doctors who developed the procedure didn't trust the colleges to teach it right.
That was in the 60s?
They first came up with this like in the 40s. They refined it in the 50s. But when chiropractic really proliferated and all the schools started in the 50s, NUCA wasn't part of their curriculum.
Wow.
And so it's only through research, more recent research, like in 2007, there was a double-blinded study done that shows that the NUCA correction lowers blood pressure in people with hypertension. And that sent a shockwave through our profession. And so now there's NUCAs being taught in a half a dozen colleges around the country, but it's still a very small fragment of our whole profession.
Mm-hmm. Kerry, is it possible for me to go in and out of alignment on my own?
Once it's buckled out of a line, it's very difficult.
Okay.
I find it almost impossible for it to self-correct. You can have good and bad days. The equation I use is misalignment or subluxation plus stress equals pain and dysfunction. So you can get along just fine and have a misalignment in your spine, but as soon as you put your body under some sort of a stress, then that's when it can squawk.
Mm-hmm. So when you have people that come in to see you and they describe their symptoms and they say, I feel dizzy, or I feel like I've got these sea legs and I'm not sleeping well, is your natural instinct to say you're probably out of alignment?
When somebody... Yeah, because they'll come to our office and we just start with a sit-down conversation, right? Consultation. And I always tell people this is a conversation, not a commitment.
Yeah.
And so we have a conversation about their symptom or symptoms. And then I will tell them if I feel, I'll usually stand up and I can scan somebody's neck with my fingers in about 20 seconds and tell you if you have the problem up at the top of your neck.
Right.
And so if they have the and then we go through not a real long, but a very brief postural assessment to determine if their head has been shifted on their neck. Mm-hmm. And then following that, I give the patient the option to proceed with imaging or to go home and think about it. We obviously, it's unethical for us to guarantee that we can help somebody, right? I was on the chiropractic board for several years, so I know that. And so we never tell anybody at the outset that, we're going to get rid of your problem. What I tell people is, you have the problem we work with. We're really good at correcting it.
Mm-hmm.
We've been blessed that way. And you're going to get my best correction. And, in most cases, patients respond really well.
Mm-hmm.
And some people have a health battle that isn't going to go away, right? But oftentimes being in a line and having a health problem that coincides with that, people still do better when they're in a line, even if they have other battles going on,
mm-hmm.
right? So there's elderly people that have tons of degeneration and arthritis, and they're bent over, but they still move and feel better when they're in a line versus not.
Yeah. Well, I knew a couple of weeks ago that there was something not right because I had a pain in my back on the right side, and it was hindering my head movement a little bit. And I thought, well, I'm going to come see you, and I did. And when I think I left your office, there was no more pain in my back, which was really lovely.
Mm-hmm.
And I think that I'm one of those guys that has the really good blessing of getting immediate relief because I'm not your typical case. Maybe I am, but
yeah. Well, I hope you don't mind me sharing, but as we spoke earlier, you're a fit person and you lead a good lifestyle, and so you probably don't deal with a lot of systemic inflammation.
Mm-hmm.
But we see a lot of patients, a lot of people that their diet is bad. They sit for a living, which is
makes it harder, doesn't it?
It's kind of the new smoking, right?
Yeah.
And sedentary. They don't eat well.
Mm-hmm.
So many of our foods are inflammation producers now too.
Right.
And so they're dealing with a lot of systemic inflammation, and guess what? Their response is going to be a lot slower.
Yeah. Dr. Kerry Johnson is my guest. If you have a question or comment, the text line is open, 877-933-2484. You can learn more about Kerry and his work at johnsonspinalcare.com. He deals with that upper bone in your neck that your head sits on called the atlas. And that, when that gets out of alignment, there's always some kind of trouble. And when it gets back in alignment, boy, things start flowing again. We'll be right back. Welcome is a word said universally all over the world. Every language on the planet has their own way of making a friendly greeting. At Faith Radio, when we welcome, we really mean it. Learn more about us by requesting a free welcome pack gift. Text the word welcome to 877-933-2484 or visit myfaithradio.com to request your welcome pack today. And a warm welcome to you. So glad to have Dr. Kerry Johnson with me here in studio. Kerry is the founder of Johnson Spinal Care, Dr. Kerry Johnson, and he is a NUCA expert, and he is involved in helping get us in alignment. I've been out of alignment a number of times, and he has helped me return to alignment, and it has been a remarkable thing. I'm a little reluctant, Kerry. I think the first time I came, I was a little nervous, a little reluctant, and you gave me that kind consultation. I wasn't signing up for a bunch of visits. You said, let's just see how we can help. And the help was so immediate that I left. I don't think I came back for a while, but there was no pressure, and you just helped the way you could. So thank you for that.
You're very welcome.
Yeah.
Yes.
All right, here's another question. Have you found any success treating restless leg syndrome?
Moderate.
Yeah, that's a real mystery, isn't it?
Mm-hmm. Mm-hmm. Yeah, I think there's nutritional stuff going on there, and could just be even some neurological degenerative issues going on. Like people that are diabetic can have issues with that. But I would say 50% of the time we'll help somebody with that.
Mm-hmm. So, Kerry, how can so many things be positively affected by this procedure? This simple procedure that when it happens, you can't even believe it's happening. And then when you say, I'm done, I can't believe you're done.
Right.
Yeah.
Well, in order for us to be 100% healthy, our brain, which runs everything in the body, right? Our nervous system is the master system over all of our other body systems. Our brain has to be 100% connected to every cell in the body. And so the brain, number one, has to be healthy, right? And we talked about that earlier with like cerebrospinal fluid and washing it and cleaning. You know, are you walking around with a polluted brain?
Right.
But then there's places in the spine that can block that nerve flow from your brain to your body and from your body back to your brain. And that's the premise of chiropractic, is that if you have a misalignment of your spine that's negatively affecting your nervous system, you're going to have problems in your body somewhere. And you can predict, based upon where that blockage is, what the problem will be oftentimes. Now, when you're talking about the very top of the spine, every nerve that goes to every part of your body has to pass right through there.
Right.
So it's just a vital area. So it's the weakest place in our spine, adjacent to Grand Central Station neurologically. I remember asking the Lord one time, Lord, why did you design it that way, right? To where we have the weakest two joints in our spine.
At the top.
At the very top where the brainstem is, the cranial nerves, the vagus nerve, superior sympathetic ganglia, these blood vessels, like all of that happening. And you know, the impression came right into my head right away that you were not designed for this environment. We were designed for the Garden of Eden. And it was a perfect design for what he intended for us.
Right. Then comes the fall.
We have the fall. It's interesting, even the word fall, because often at times it's falls. Gravity, this force driving us into the ground, is often the
reason that we're out of alignment.
The reason we get buckled out of a line.
Yeah.
Right? And so, yeah.
So if I were to get adjusted, and I shouldn't only speak for myself because I've had such amazing results from you, but what would I expect from my adjustment? Would I feel this kind of significant change that Bill talks about? Would I have to wait and see? Would I be dizzy when I left your office? What would it feel like?
It's So the thing that we do is we do the imaging. I go through my whole analysis. The patient comes back. They get corrected. And then we do a follow-up image. Okay, so the first and foremost is we have to know that we did the job, right? And this is one thing that's really, I believe, awesome about NUCA, is that we stop right after the very first adjustment and we check with another image to see if it did what we intended it to do. Did it correct? And, of course, the better correction that we can get, typically the better response that a patient will have, okay? But, patients can go through all kinds of stuff in their first month of care, in the first week. So I would say probably the most common thing we hear from patients right after the adjustment on the same day is, oh, my gosh, am I tired?
Things are flowing again, aren't they?
Yeah, they want to go to sleep. Their brain wants to go to sleep so it can heal. So they'll feel tired or malaise. Some people get emotional. Like I had a guy that couldn't stop laughing for 3 hours after correction, right? So some people feel a little weepy, but then they'll usually get a really good night's sleep that first night. Like a lot of times I have people come, I haven't slept this good in a long time, and but then over especially the first week, because we've actually changed their relationship with gravity, they could get some little migrating aches and pains in different weight-bearing joints, because your knee is supporting your body just a tiny bit different than it was the day before I adjusted you.
But in a healthy way.
In a healthy way.
Yeah.
But the joints have to adapt to, so what's right, they're not used to. They're used to being out of balance and have this posture distortion. So when we line them up, in fact, you know that people are taller after I correct them. A lot of times people go to the doctor and say, my doctor measured me, I'm a half-inch taller than I have been.
Interesting.
Right? Because their spine is vertical. It's not in a distorted posture, which will shorten it.
Yeah.
And there's not too many others. Some people can feel a little lightheaded after an adjustment. And then as far as the symptoms go, we can't predict that, right? Like we have a little saying, like we move the bone and God does the rest.
I love that.
And so everybody's healing rate is different. It's based upon how much stress they have in their life, genetics, lifestyle, nutrition. So there's, ergonomics. So there's a
Right.
lot of factors that go into how quickly people respond. But, and there's some people that just have really chronic conditions, and it's just a real battle for them in their recovery, and it's slow. I'll tell some people, yeah, you know what, your recovery is going to be a marathon, not a sprint.
Mm-hmm. Dr. Kerry Johnson has been my guest. That's all the time we have. Have a great night, everyone. See you tomorrow. Thanks for listening. Programming like this is made available through your support. Information available at myfaithradio.com.